Hello. Oh, 1 second. Hello and welcome to the Northeast AHEC Delivering Telemental Health webinar series. A few things before we get started. This webinar series is funded by HRSA and the Aberdeen Area Community Foundation. We will be utilizing the chat box for any questions during the presentation as well as afterwards. So if you would like to put any comments or questions in the chat box, we'll make sure they are addressed. And without any further ado, let me introduce you to our speaker for today, Dr. Laurel Kaiser she will introduce the rest of herself. So thank you.
Hello, everyone. I'm Laurel Kaiser. I am a psychologist. I work primarily out of Baltimore, Maryland, and am affiliated with the University of Maryland School of Medicine. And I'm principal investigator of the Family Informed Trauma Treatment Center, which is a NCTSN or National Child Traumatic Stress Network Category 2 center. And I'm really happy to be here today to talk with you about counseling families through COVID-19 situations. And my primary work is related to families and high stress and trauma, especially families that live in context where they face chronic trauma and high stress circumstances, often across generations. So I do want to keep things as open today as possible in terms of a conversation that we might have. Next slide. So I wanted to start off with some objectives. We're going to learn a little bit about family adaptations to chronic stress and trauma. And then we're going to talk about some ways that I have been working in with an intervention that I developed called Strengthening Family Coping Resources to offer that intervention to families through telehealth. But I'd also like to make sure we can have some conversation about some of the work that you're doing, and people can share some of the solutions they've found to working with families in these very difficult and stressful times. Next slide. So I just wonder if folks could either unmute themselves very quickly and just chime in about what you'd really like to get from today's talk. And then since we're talking about families, is there something you would like us to know about your family or the families that you work with? And you can put some comments in the chat, or you can take yourself off mute and jump in. I know there are some people out there.
I'll speak. My name's Trina, and I'm a therapist. And so I'm actually in kind of a rural area where we haven't been impacted a whole lot until now. So we are going to be using telehealth here. And I mean, we have used it, but I think more so in the coming weeks and months. And the challenge that I've had is a lot of the clients will say it's just so hard to connect. There's just that through a screen, it's just so much harder. And sometimes I find it difficult to engage the client.
Mm-hmm. Okay.
I'm Kelly, and I'm in Michigan. I am case manager for a community mental health program, and I actually started this position in June, so in the middle of this COVID crisis. So all I know of 98% of my consumers is telehealth. which many of them are in like specialized residential facilities, and they lack technology. So a lot of our contacts aren't even video, they're just over the phone. And so to a number of my consumers, I'm just a voice on the other end of the phone as of this point. So that's been difficult. It's definitely added to the stress of building rapport with consumers. And yeah, it's just had its challenges, but we're slowly trading back to face-to-face, just because we've seen the number of crises with our consumers escalating over the COVID period.
Great, thanks.
It looks like we have a couple comments in the chat box saying that a lot of them are struggling with families who have loved ones who have died.
Okay, and additional stress, and it sounds like just struggling with ways to connect. Okay, and I think, you know, as clinicians or service providers, one of the big things that we're taught, and one of the things we know is the most important in terms of outcomes, is that alliance, that connection that we make with people. That it creates the ability to trust, the ability to be open and share things, the ability to listen in a different way. And we're trained primarily to do that in person. And I think we're all trying to adjust to what those connections look like when it's over a telephone or over a video camera. How do you make eye contact? How do you project a warm, friendly voice? What tones do you use? And we know from our physiological science and from from everything that we study about the stress response, and also about our sense of safety, that those things, gaze, the expression on your face, smiling, your tone of voice, your ability to use prosodic voice tones and express yourself in that way, have a lot to do with how people connect with each other. And I do think it's really important to consider how we do that over video. And we're going to talk some about that, but also about even making it more difficult, and how do you do that with families and with multiple families together. Or at least with adults together. So let's, I'm continuing to follow what's being put in the chat, and thinking about language barriers and how to use interpreters. All of these are great questions. I don't know that I have the answers to them, but and so we'll continue on, and hopefully people can share additional concerns and interests that as we go through the presentation. So next slide. So I'm going to talk a little bit about how families adapt to situations of chronic stress and trauma. And one of the things we know is that families who live in traumatic contexts, who live in poverty, who live in stressful situations where there's ongoing threat, have to make adaptations to the way they cope in order to survive or thrive in those kind of contexts. And we certainly know that the families who are living in those kind of chronic stress and trauma situations are experiencing a lot of disparities in terms of susceptibility to COVID, in terms of the severity of their cases, and even in terms of mortality related to COVID. And so this is an important group of people to understand, and to understand the additional stresses that COVID has placed on top of these families. So next slide. So we talk a lot about traumatic context, and I think right now we are all living in somewhat of a traumatic context between the COVID and the increased cases of COVID around the country and around the world, between the uncertainty in our communities about our political affiliations, between the increased racial tensions and discrimination, racial and ethnic discrimination and tensions in our country. We're all feeling more sense of threat, less secure, more uncertain about what's going to happen on a day-to-day basis, and what kind of policies and health recommendations are going to be out there for us to follow, and for us to follow with our families. Whether our children are going to be in school, all of those kind of things are part of this kind of uncertain, unpredictable context that we're living in right now. And one of the things we know is that affects the family as a whole, but also all the different moving parts of a family, all the subcontext, the sub-relationships, the subsystems within a family are impacted by that traumatic context. Next slide. So one of the things that is important to understand is how that impacts families and family outcomes. And a lot of ways that it impacts it is that individuals in the family can be very distressed by what's going on, by living under chronic conditions where their stress levels are very high. So they may have trouble sleeping, they may be worried and highly anxious, they may be fearful, they may be irritable, and they may feel depressed or become withdrawn and isolated. And those individual symptoms especially are difficult on parents and have major effects on parenting. And that in turn affects family functioning. And then that affects outcomes for everyone in the family. So it's just really important to understand how the kind of risks that are associated with a traumatic context kind of wind their way through the family and then are shown as negative outcomes potentially for everyone in the family. Next slide. So what are some of the things that you're experiencing with your families during COVID? What are some of the parenting concerns? What are some of the things you're hearing about from the children that you work with in your family? These are often mentioned with the families and the parents that we work with, but I'm also interested in hearing from you what some of the issues are and what are some of the struggles that you're hearing from families. Separation anxiety for young children was entered into the chat bar. Thanks, Trina. That's a great comment. I think, kids are very anxious about what's going to happen on a day-to-day basis, who's going to get sick, why people are walking around with masks on, why school is off or on again, why they can't see people that they're accustomed to seeing or go places. So, and I think that has increased anxiety for young children, and separation anxiety is one of those ways that they really show that anxiety. Couples, somebody said, heightened irritability and arguing. We know that forced proximity has been an issue for couples, for families, for all of us who live with multiple other people, and irritability and arguing, and even leading to increased domestic violence, which has been indicated as a major kind of side effect. I think Quandra made a great comment about developmentally delayed or disabled clients who are kind of disoriented. And I think that's a wonderful point. One of the things we know about families, and this would respond to older populations, people with Alzheimer's, I saw a note about that, as well as people with developmental or intellectual disabilities or challenges. The one thing that gets that is very vulnerable and is one of the first things that changes in stressful situations is our ability to carry out our routines and habits. And this is the one way that families get very disorganized. They get very disjointed, and often resulting in increased anxiety. One of the reasons why we develop routines and habits is to create a sense of predictability and safety and control over our environment. And when those are lost, that raises our anxiety. And unfortunately, in this pandemic, all of us have had to change our routines, have to change our usual habits, and things that give us that sense of predictability and peace. And that's certainly been true a lot for families, especially when families have had to change school routines, folks have had to change work routines. They've had to change their routines about who's involved in their family life. Where do they get their social support? So I'm seeing a lot of great things in the chat bar. So thanks to everybody for those comments. We are seeing also a lot of financial instability and residential instability, with houses getting overcrowded and people who are doubling up or maybe have been tentatively housed, not being able to share space any longer if they can't stay safe in certain ways. And certainly lots of people have had to change their work lives to accommodate. So thanks for all those wonderful chats. Anybody else have anything that they'd like to add in terms of, I think in the previous discussion we talked, there was, quite a bit of mention of the loss and grief that people are experiencing. And it's not necessarily just the people who have passed away, and often passed away in isolation, where our rituals for being able to separate from somebody have been totally disrupted. But just the loss of being able to see our loved ones on a regular basis, I think it has been quite extraordinary for people, in addition. So I think one of the things that we try and pay very much attention to is that kind of the dual and competing dynamics of forced proximity, which, if we're sheltering in place or having to stay home, you know, or not able to go to big social events or even family social events. But we're forced to stay, you know, with a much smaller group of people and have much less access to others. There's that kind of forced duality between feeling isolated socially and that forced proximity of you know, feeling irritable with the ones that you are spending so much of your time with. One of the things that's so important for parents and caregivers is to be able to get out and take breaks and have respite. And school was a good part of that. Work was a good part of that. And without that, we're having much more trouble negotiating our relationships. Okay. Anybody else want to add something with their voices? Okay, next slide, please. As part of the Family Informed Trauma Treatment Center, as I said, we've done a lot of work on what kind of accommodations families make to distress. So this is kind of an overview of it, and I'm just going to talk about a few of the points as we go through it. And as you can see, we talked a little bit about the individual distress, and then there's distress in multiple relationships, especially the parent-child relationship, and people pointed out the couples relationships. And then we have disturbances in the family unit itself. So go to the next slide, please. One of those disturbances is being really anxious all the time. And when families are experiencing anticipatory stress, they can become highly reactive, or they can become really avoidant. And we're really seeing a lot of that in families, that there are many families who are having a hard time regulating their mood, regulating their behaviors, perhaps devolving into conflict and violence. And then there are other families who, you know, are just avoiding dealing with what's going on, and they may be very isolated and withdrawn. And that can go from individual family members all the way to the whole family unit being very withdrawn and isolated. Next slide. We know that this kind of stress and anticipatory anxiety leads to chronic wear and tear on our systems. And one of the things we see in families is difficulties modulating conflict, and also, you know, a lot of dysregulations, and may even lead to problems co-regulating together, which is a really important part of what families do for each other. And what family members are really used for and important for, especially in parent-child relationships. And when parents get to that kind of tipping point when they're not able to regulate themselves, then they have a really hard time helping their children regulate or deal with perhaps the anxiety they're feeling. Next slide. It also leads to, you know, feeling disconnected. And we use connectedness to feel safe. We use connectedness to know that somebody has our back. We use connectedness for that co-regulation. And when that becomes threatened by really high stress, we can really get into major problems. And so that sense of connectedness is really something that we pay attention to, and that I think people were really talking to in terms of the disruptions that COVID has caused, especially in our vocations, in our ability to work with people. Next slide. And we see this kind of disconnectedness all the way across our social support systems, from within our families. One of the things I've heard a lot about is that there are a lot of couples who are planning to get, or who already have separated or decided to divorce, that not having that ability to balance social relationships has with their marital or partnership relationship has really increased the stress on those relationships. Also, it's disrupted our extrafamilial relationships, those family members that either live far away from us, or who are elderly, or have young children, or have jobs that prevent them from being able to social isolate, or protect themselves from contacting the virus. There have been a lot of separations. And then, it's changed our support systems significantly in terms of both formal and informal support systems, and who we're able to get that support from. So it's really caused major disruptions in relations and supports. Next slide. And these are already problems for chronically traumatized families. The other thing that's really important for families that are chronically traumatized is what kind of schemas or stories or worldviews and beliefs they operate under. And I know that when I go out and I'm around people, I tend to be very friendly. When I'm around people I know, I like to give hugs. I trust people. And, when I go out and take a walk and move 6 or 10 feet away from somebody who's walking without a mask or something, and I'm doing that physical distancing, it's very foreign to me. It's not part of my schema of the way the world works. And as that continues, those schemas may change. They change consistently for families who live under really traumatic situations. Next slide. So here are some of the ways that, and examples of altered schemas that, in some ways may be very realistic for certain people, but they make it very hard to use healthy coping mechanisms in our society, at least. If we believe the world is a dangerous place, it's very hard to be in helping relationships. If you believe the world is a dangerous place, trusting others to keep you safe or have your back is a very uncomfortable thing to do. If you believe bad things are going to happen to you or the people in your family, your sense of being able to control that or make good things happen, or even have a sense of a positive future and optimism are changed, all of which are tied to family well-being and important strategies in raising children, to be able to instill hope, optimism, and a sense of life purpose. So here are some of the things that families that are under chronic stress deal with. And we can see that under COVID, all of these things are possible for families. And so it's really important to think about how to help them cope in healthy and resilient ways. Next slide. So how do some of those things show up in your work? The disconnectedness, the lack of regulation, or the lack of being able to regulate within your family, the worry and the coping in an anticipatory way that includes lots of anxiety, worldviews and beliefs. How do those things show up in the work that you're doing with the families that you work with?
I work quite a bit with adoptive families, and something that I'm seeing is that these mothers, typically moms, coming in very distressed and overwhelmed, and just the belief that they should be able to handle it all, the homeschooling and working from home, and just trying to manage it all, and they don't need any help. So that's kind of the theme that I'm hearing from those families.
Okay. So a sense that they have to take on all of these multiple roles and be good at them, and without any help. Who else is seeing some of those things in your work?
It looks like there's a comment saying seeing breakdowns in communication due to stress and overwhelm.
Mm-hmm. Mm-hmm. Yeah. And communication within all kinds of relationships, I think, is being challenged. Yeah. Working from home when there are so many other things going on. I'm really responding to that personally, because I worked a lot from home prior to COVID, but my husband was working, and so home was my sanctuary. And after COVID, and he also kind of retired at the very same time. And so he's been home all the time. And so my work at home kind of sanctuary has been very much changed. So, okay. And then, for people who are unable to understand perhaps, or cognitively appreciate why, for either young children or people with intellectual or developmental disabilities, why things are happening, why they can't see the people they love, really misinterpreting that, having impaired appraisals of what that's about, maybe personalizing it, and then having disruptions in family relationships, perhaps because of that. So I think one of the examples in the chat was that, if you're separated from your family, if you're living in an institution and all of a sudden your family can't come see you as a health precaution, how do you explain that to yourself? How do you figure out that that's not, it's not that they don't love you anymore or they don't want to see you. It's a health precaution for everyone. So really understanding and helping people appraise situations that are very unfamiliar to them can be really challenging. and can put significant strains on family relationships. Anybody else have things they want to add?
So this is Laura. I work in a health system, and one of the things that I have seen, we have a zero suicide initiative, and what I've seen is providers kind of normalizing this distress and not really validating a patient's response or situations when they share, I'm having this additional distress at home or anxiety, so they don't probe further to see if there's things that can help them with. It's just kind of brushed under the rug of, yes, it's COVID. We're all, kind of dealing with this increased anxiety and distress. So it's fine, let me just treat you for X, Y, and Z.
Yeah.
So that's kind of been difficult to navigate.
I think that's a great point, because everyone is under these stresses. They're kind of usual. It's like we can't pay it to, we can't honor and respect that for some people. And it may be for everybody different parts of what we're changing or giving up, or what we're doing to accommodate to the new normal. Maybe, substantially stressing people, causing substantial symptoms, or exacerbating, their underlying conditions in ways that are really significant. And I think that, there certainly have been calls for paying attention to the additional and major mental and physical health problems that are going to be, secondary perhaps to COVID, but are going to be equally as important to deal with. What is this doing to all of us? And how do we as healthcare providers and service providers deal with that and be able to listen to people? Yeah, I think that's a great one. And somebody saying, yes, that nursing home clients are really feeling some of those stresses and strains. So yeah, important to think about. Families extend, all the way to those who are living in nursing homes for both age and disability reasons. Okay. Are there other comments? Okay, so I want to go ahead and talk some about some work that we're doing. As I said, I developed an intervention. It's a family-based intervention called Strengthening Family Coping Resources. And I'm going to tell you just a little bit about it and how we're adapting it for COVID-19. Next slide. So there are two kind of primary goals for the intervention, and one is to decrease the impact of chronic trauma and high stress on identified family members or every family member, and to increase the protective function of the family by really helping them build coping skills, resilience, and a sense of hope and future opportunity. Next slide. SFCR has all the components that are typically found in trauma treatments. And as the developer, I'm not just saying this, it's actually been studied by an independent review board that looked at multiple trauma evidence-based practices and was ranked SFCR as including most of the components or all of the components. Next slide. In addition, SFCR, we spend a lot of time working on family coping resources. And on this list, you can see a lot of things that probably you're very familiar with as ways to work with families. So I'll just touch on one or two of them. One is deliberateness, which may not be as known to people, but it kind of takes into account problem solving, planning, future orientation, mindfulness, keeping problems separate from family rituals and routines. And so it's a very important concept when things are feeling very chaotic or unpredictable and uncertain. And then the other one I want to pay attention to is the positive affect, memories and meaning. And I think that's been one of the things that we've really tried to emphasize both in our treatment during regular conditions, but also under COVID, that it's still really important to celebrate the small things, have gratitude for the things in life that are positive, express positive affect and nurturing within families, make the most of some of the memories that you're able to create now, even if, you know, they're different. You know, and I think we're coming up on a period of time. The holidays can always be difficult for families. And when families are having to readjust their expectations and maybe not have the same kind of gatherings or the same kind of holidays, they really, you know, think, well, this is, you know, this is awful, we're ruined. And, you know, I think it's really important to help them say, okay, what are some of the positive memories I can make out of this? So we typically do strengthening family coping resources as a multifamily group or as a group for parents or adults who are dealing with trauma. And the adult parent group is run typically by peers trained to do the group. Both groups are manualized, and here's some information about how the groups are set up. And we're actually offering both the multifamily group and the peer-to-peer model virtually now. And so really working to keep families connected with each other, to keep them in treatment, to provide support and help them build some new skills for coping with this. And one of the things we're doing, well, actually, I think I have some slides that talk about that. So let's go to the next slide. So we're providing technical support for families. I know that there may be some, you know, people said there are difficulties connecting, and we have somebody who's working on the technical support side of running the group, helping the families understand how to do their video setup, how to help them obtain equipment, microphones, hotspots, if they don't have those. We have kind of a lending library set up so that we can help some of the families. Because we're doing a family intervention, sometimes we want multiple people in the family to have separate equipment that they can be on, so we help with that. We're setting up a space for participation in the group outside of the video rooms. So we have a Google Classroom set up where we put all their materials, where the families can post things that they share just with their family or just with the facilitators or the staff running the group, or they can share with the whole multifamily group. We've even, you know, gone so far as to work with, you know, how can the family arrange themselves during activities so that everybody in the family is on camera and able to have a voice in the discussion, in what's going on. And so really working on the technical side of things and helping the families with that. And I think they've really appreciated that support. Next slide. We also know that we have to set up safety guidelines for the families for group, both assessing, kind of immediate danger and privacy concerns while they're on the video session, helping to de-escalate family conflict over video, especially when there are other families on the screen. Acknowledging to the family that they're letting both the staff, but also other families as part of the group into their home. And what does that mean? What does that mean about what people are seeing about their space? What do we do as facilitators and mandated reporters if we see something in the home that doesn't feel safe, or we feel like we have to make a report about that? And what do we do if, one of the families gets into crisis or we have session disruptions because of technology? What kind of backup plans do we have for that? How do we reach somebody who seems to be in distress, who might hang up or leave the call, and we're left not particularly knowing that they're safe or well cared for or able to get help? I think the comment from the person working in the healthcare setting where suicide has been a real issue is part of that. How do you do that outreach in a way that can help protect people if things really de-escalate? So important kinds of issues to think about. What kind of safety concerns and guidelines have you done with families or figured out are important in terms of maintaining safety for people when you're dealing with them over telehealth? Have people run into situations where something didn't feel safe and figured out a solution or a way to help with it? How about privacy or confidentiality concerns? Okay. I know I've heard some things about, or some solutions about keywords or, things that people can say if they're not in a safe situation, or they're not talking in a private situation. And so it's changing the answers they're giving you, or the way they're talking to you, or the information they're willing to divulge. And I think that's one important thing. I think it's important to talk about, especially in family situations, the issue of confidentiality and what's shared. We were doing a family group, and a parent talked about kind of without permission, her daughter's sexual abuse history, and created a lot of, conflict and bad feelings between mother and daughter until they kind of worked it out. And so, I think those are some of the things to think about. Any other comments on this kind of topic? Okay, next slide. One of the things we're trying to do is translate the things we do in person to things we can do on you know, through a virtual environment. One of the things we're doing is we typically start our family groups with a family meal, because sharing meal times is so important for families and is such a high protective skill for families to develop, is to regularly share meals together. And so we would have food and each family would sit at their own table. Since they're not coming in, we did not want to give up that, that family ritual or that support for families in developing that family routine. And so we're sending families meals before every group, and then they have time in group to sit down and have their meal together. As I said, we've tried to translate a lot of our activities and materials that we use to platforms that we can use online. So on the left side of your screen, you see a spirituality word flower that we do in a session with the families when we're talking about spirituality. And on the right side of the screen, you see the virtual version. And what we do is have the families fill in a word in each petal, and you know, our facilitator is one of the facilitators is filling that out in a PDF or a Google Doc or something like that. And so we're trying to keep group activity pretty much the same. In our parent groups, we are using a lot of group discussion and helping to try and facilitate relationships among people in the group. For instance, one of the things we do is set up a phone tree between the members of the group, so that there's an expectation that between groups, they call one other person in the group as a way to develop community and to you know, build that sense of social support. So there are a lot of ways we're trying to adapt the activities and the things that we do to help support families in very positive ways. We also give them homework or things to practice during the week. And, you know, we're actually trying to communicate with them more than we have by getting them to fill out things online more frequently during the week, or to talk to us more frequently during the week about how things are going and how their practice of family rituals and routines is going. So I think I want to stop here and make sure we have time for questions and some reflections. So I'd like to open it up to anybody who has questions or other strategies that they've been using to connect or work with families, and how that works.
If you guys would like to put it in the comment, I can read it, or you can send it to me as well too, and I can make sure it's addressed.
If there aren't questions, how about comments about how you might apply some of that to the work you're doing? I know that, for instance, some of you are working, you know, with schools or with nursing homes or with healthcare settings or as case managers. Are there ways that you could apply some of those things in the work you're doing in terms of doing or having virtual family get-togethers or some ways that you could help families connect with one another in ways that would help with some of the problems that you're seeing. It got to be a very quiet group.
I just had a comment with regard to what you had shared about helping families with technology. And I think a lot more work needs to be done with that, with patients that are accessing mental health care as well as physical health care through telehealth. And then I guess taking it a step further so that they're not just applying it for appointments, but can apply it within their own social networks. So can you take this skill that I've taught you and apply it to, connecting with another family member that you can't see?
Uh-huh. Yeah, I think that's great. It's a pretty intense. I mean, we have kind of added a staff person whose role is really to provide, part of what she's doing as part of now her full-time position is to provide that technical assistance, not only when we're on the sessions, but in between sessions, talking through those kind of problems with families and helping them from a technical side. And I think you're right. It's really important for us to be able to do more of that. I know for so many families, just the technical part of trying to do the homeschooling or the virtual school has been so stressful, and people are missing things or not one parent told me that, their child brought home a C- or something in spelling, and it was because she didn't technically how to get the spelling list, on a regular basis. And so just things like that end up being very stressful and trying for parents. And I think if we had more support around that, and clearly we can't expect teachers all of a sudden to be doing that now too, providing that technical assistance to parents, but schools and healthcare facilities and nursing homes and all those should really be facilitating that kind of work with families. I know that there are some nursing homes who have facilitated regular virtual visits with a client, with a resident and, their family member, and that's, what they did. But in other settings, that's been dependent on a health aide or somebody else that the family was paying for to facilitate those kind of visits. But I think you're right. It's going to be really important to support families with technology. So I think we have a minute left. I did give some contact information, and I believe it was on my last slide, but if people have questions or want more information, you're more than welcome to get, to get in touch with me. And I appreciate everybody's attendance today. Great, thank you for putting that back up.
And then with that, if you would like CEUs and you're not registered for this, please message me. You can either message me privately or whatnot, and I will stay on for the next couple of minutes just to make sure everyone has an opportunity. And thank you very much.
Thank you for the nice comments in the chat. Thanks, everybody. Bye.
Bye. With that being said, I am going to sign out and thank you for all for attending, and feel free to register for our future webinars.